Okay, we're live at CHD TV. Right, tell us your name.
Hi, my name is Diane Borner-Day, and I'm a nurse midwife.
And you tried to fight the system, and anyway, let's go back. Go back and tell us what happened.
So, long story short, I found a wonderful job working in an eastern Oklahoma hospital where the midwives did all the births and only called in the docs when we needed them, and had great colleagues, great nursing staff. Loved it. And I don't know the timeline about when things happened.
That's okay.
So at some point, the midwives were asked by the pediatricians to do the newborn orders. So if I delivered a baby, I would put in the orders for the baby's medications and for the nurses to do their care. And that was fine, no problem really. It's not
Why would a
medication.
newborn need a medication?
Right, because it's always been standard of care to give babies the eye ointment for the chlamydia, the vitamin K, which after years of using it, I've started to learn about it, like maybe we don't really need it. But anyway, so that was fine. I just did that. And then, I don't know when, but at some point, the Hepatitis B vaccine was on that list of things to check off in order. And I don't know at what point I ever woke up, but at some point I realized that there was no need for this vaccine on the first newborn day.
Did you have to give the vaccine?
No,
That's one
I've never
good thing.
given
Right.
a vaccine, and I have never given or ordered a vaccine in pregnancy for a woman. Never. Now they give it routinely. They give the Tdap and the COVID. Other story. That's a long story elsewhere. So, anyways, check this off, and I learned slowly over time. I think the nurses would come to me. One nurse in particular, she was fabulous. She would note that these babies were starting to get this full-blown body rash, like a raised red, angry rash. And the babies that were nursing really well to start with, by the second and third day, they had gone off nursing. So, little tweaks. Somehow, some way, I got a vaccine vial insert, the big long paper that they put into the vaccine box that nobody ever reads, right? It gets tossed out. So I read it, and I read about the ingredients, and I learned that there's aluminum in there, and it's as a preservative. Sounds reasonable, you know, you got to preserve your medicine, and but the amount was 250 micrograms. If you go to the PDR, which is the physician desk reference, it will say there's a black box warning that says don't ever use more than 25 micrograms. And it's always given parenterally, and that's IV or IM, and just don't do it, you know, in the black box. And here we are. I stared at it, and I couldn't believe it.
And we're talking about the Hep B.
Yeah. So every dose of Hep B has 250 micrograms in it, and then they get it again 2 months later, and then they get it again 4 months later. So by the age of 4 months, they've had 750 micrograms. The other thing is that the same vial is used for a 6-pound baby as it is for a 12-pound baby, as it is for a 24, and then you go to linebackers, 250-pound linebackers, going to get the same. Correct me if I'm wrong, but I believe that's the case. So there's no dosage with every other pediatric medication. It's dose related, and you be very, very careful about the doses that you give babies.
So how did you fight it?
So it was. So eventually, I got to the point. So initially, I would go into the patient, the moms and parents. I would go in and I'd say, I have to order this medicine for your baby, this vaccine for your baby. Do you know what it is? Do you know what it does? Anything about it? No, they didn't know. No one ever knew. And so I said, do you want it? And I explained it was for a so Hep B vaccine is to help prevent sexually transmitted diseases that come through sex with infected partners or IV drug use. And so they would look at me like, well, my baby's not going to be doing any of that. And I said, I know, so think about if you want it. Well, there was a nurse there who was very pro-vaccine, and I think she kind of turned me in, but went along there, and then it got to the point where I couldn't do it anymore. There was too many people accepting it, and I said, I'm not gonna order this anymore. So we had a meeting with the upperlings, and they brought in the Hepatitis C doctor. He was doing a big program to give a new medication for patients with Hep C. And he came in to try to talk me into about how safe this was. And I went into the meeting with a pile of documents all on aluminum, on no safety studies, all of that. He looked at it, turned around, and walked the other way. He didn't even want to. It was like he saw, the devil or something. So that he tried to tell me about the Alaskan teens, that there was an epidemic of liver disease up there, and they really wanted to address that by starting this Hep C vaccine early. And I'm like, those Alaskan teens are there because with liver disease because they're alcoholics by the age of 18. They started at 10. Anyway, so I got to the point where I couldn't order it. So that was fine. They couldn't fire me. I had never done anything wrong. So they worked it so that the nurses would order it. And that was great. That was fine. I could deal with that. But then I couldn't keep my mouth shut. So I would continue to go in and do what's called informed consent, which back in the day in medicine, in good medicine, you would do with all your patients. You would tell them risks versus benefits, why you're giving a medication, why are you going to have that procedure? Do you know that that procedure carries a risk of bleeding and death? Do you know that? Okay, you're good, sign the consent, informed consent. So I would go in there and tell the patients, I'm ordering this. No, I already did that, but I did it in the prenatal visits. So as the pregnant women are coming in, every month, 2 weeks, 1 week, you form a bond and you start teaching, and I do that anyway. And so I would talk about what's going to happen in labor, what's going to happen at your delivery, and what's going to happen postpartum. So that got around that I was doing that, and so a lot of people were not getting that. Yeah, I didn't tell them not to. I just said go and research, go and learn about it. That's all I would say. So apparently a pediatrician in the town heard that someone was kiboshing his schedule, got very angry, and because what was happening is they weren't getting it in the hospital, so it threw off their schedule. They had to wait longer. They come back in at 2 months and get the first dose, and the pediatrician was not happy with that. So
no, because it affects his bonus.
Yeah, absolutely. So finally it got to the point, and it was never acrimonious. It was never, no one was nasty. The other midwives would say to me, Diane, why are you doing this? Just leave it alone. It's not hurting them. There's no injury. They didn't use the word injury, but there's no harm. You're not doing any harm. And so I said, I disagree. So anyway, there was a meeting, January 2020, and they came in and the upperlings were there, and these two doctors looked at each other and they smiled and they said, Diane, we're going to go in another direction, so we're not going to renew your contract. I said, okay. I didn't want to fight it. I was done. I was done. But it was interesting that was January 2020. What happened in March of 2020? Emergence of COVID. And did they know? Did they know that I would never go through that? I would be never wearing a mask. I would never be getting the COVID vaccine. So might as well get rid of her now.
And how did that affect your work today? Are you able to work?
So that was the middle of COVID. I took a job as a home birth midwife thinking I'm going to go to where women don't do any of this.
Right.
Ha ha ha. It was a certified midwife in Connecticut who wanted me to give the vaccines in pregnancy. That wasn't the COVID, it was the Tdap. And I said, I've never done that and I never will. And so that was the end of that relationship. She was the one who first introduced me to wearing masks. So she was saying, in your prenatal visit, wear the mask. And I would say, but in the labor room at home, do you wear the mask? Oh, no, not at home. No, we don't have to wear them at home. I'm like, okay, so what's the difference? And she just said, just do it, because I said to her, and I realized, whoa, I'm an independent practitioner. What are you doing?
I think the most disturbing thing of this story, the most brilliant thing is you standing up, thank you for that, is that doctor, the Hep C doctor,
right,
not even prepared to look at documentation on how these Hep B injures and kills babies. Just walks out because of his study.
Well, he was going to give me some data. I asked him, I said, do you have any data? Give me something to read and I'll listen to you. He said, I'll get it to you. He never did.
Of course he didn't, because there isn't data, whatever. Yeah. Okay, well, look, thank you for telling that. And what do you say to your colleagues who know, but just, don't really want, I have to keep my job? That kind. I hate that. To me, you have to keep your job, you do, because honestly you're part of the problem.
So this plausible deniability, that they can't see it. So Robert F. Kennedy Jr. came out in an interview and he said, now here's a man who is brilliant, a lawyer, who sued the HHS. Everything about him is just knowledge. He says in his own family they don't listen to him. So if you have someone like that who can't get a family to listen to what he has and look at the data that he has collected, how does anybody else have a chance, right? And so I guess what I really want to do is encourage the public, because I think this is all coming out soon. And I think the public is going to go, how did this happen? How did the doctor I trust do this? How did the nurses who were so sweet to me, how did they inject my babies with these poisons? They truly believe it's good. They were trained. We sat in classes. We were sponges to absorb the expert. We wanted that knowledge so we could go out and be, great doctors, midwives, nurses, right? We never question it. Who questions or argues with your expert? No one. So you absorb it, you take your exams, you do your boards, and you get out in the world and you work, and then you never look at another research paper. You just work, you go home, you eat your dinner and go to bed. They don't want to know anymore. They feel like I'm trained. One of the incredible things, my husband is a doctor, he would say, when I was trained, 40 years ago, when I was trained, and that's what they say, they don't ever move forward easily. They become blocked in a matrix. And so it's really, really hard to break out of that. Very hard. And they're good people. They just can't see.
All right. Well, look, we really appreciate you telling the story. Now, do you have any vaccine injury in your family?
Yes.
Yeah.
I have 2 children.
Both injured?
Mm-hmm.
Do you know what shots?
Yeah. One was the Gardasil. Totally ruined my daughter's life. She is now 33, and God bless that kid. She is now taken it on herself, and she's gone through metal with detox. She's really worked hard. What happens with Gardasil is the interstitial cystitis that occurs, and it's inflammation of the bladder, chronic pain. And no one could figure it out. It's a really hard diagnosis to make, and she finally got a doctor who looked inside the bladder and saw it was all full of hemorrhages. But then she took it upon herself to eat the diet that you have to eat, avoiding certain foods, and I'm really proud of her. My son, here he is the son of 2 medical people, and so he was always quirky. He was just quirky. Didn't like certain feels of fabric, didn't like certain foods, and we missed it, totally missed it. But he has Asperger's for sure. And fabulous kid, brilliant, but very, very quirky. I love him to death.
And you feel he changed after?
Oh, absolutely.
Yeah.
After the 3-year, changed after 3 years.
All right, well, you better go out and see Sawyer and sign the bus. And thank you so much for all your knowledge and for standing firm and being just amazing.
Appreciate
We're so grateful.
you doing all this. You're amazing.
All
Take
right,
care.
thank you. Bye.